A 2011 Lifeline survey found that a massive 93% of Australians feel stressed, and almost half of respondents constantly experienced high levels of stress. While stress is something you can't always avoid, science has proven that certain foods, and other factors, such as exercise, can help provide relief. What is stress and how does it affect us? Clinical psychologist Dr. Sandy Noor specializes in stress, anxiety and health. Stress, explains Dr. Noor, is an accumulation of things that lead to a stress reaction. It occurs when you have too many demands and not enough resources to meet them. Normal levels of stress are essential for you to perform and stay interested in life and your daily activities. However, too much stress can lead you to feel overwhelmed and result in a reduction in performance and activities. Symptoms of stress manifest in three main ways: physical headaches and migraines, upset stomach, muscle tension, disturbed sleep, changes to appetite, and heightened blood pressure. Mental: poor attention, concentration and memory, and difficulty making decisions. Emotional: anxiety, low mood, irritability and nervousness. This year's Lifeline survey of 1,200 people revealed the biggest stressor for Australians is work, finances, thinking about the future. Health and relationships followed close behind. Other common stressors include sex, family get-togethers and Christmas. Accredited practicing dietitian and nutritionist Alison Martin, who is doing her PhD in mental health and diet, adds that stress can also arise as a consequence to the way you treat your body and not having what it takes to recover. A lack of exercise, sleep or fresh air, a busy lifestyle, as well as what you're putting into your body, such as an unhealthy diet, alcohol and drugs, can also result in stress. Left unchecked, stress can escalate and have more serious consequences for both your physical and mental health, so it's important to try to manage stress as soon as it begins to affect you. Stress and your weight. Another potential side effect of unchecked stress is weight gain. Prolonged stress can result in cortisol, the stress hormone, increasing, says Dr. Noor. Studies published in the journal Obesity found that increased stress, and the production of cortisol, can cause hunger and ultimately, weight gain. The other hormone that contributes to weight gain in stressful times is ghrelin. It's the hormone that tells us we're hungry and, according to research published in Neuropsychopharmacology, it also increases cortisol levels, which makes us even hungrier. This is concerning when it comes to stress, as eating is a common coping mechanism. People often engage in other, unhelpful coping strategies, such as increased alcohol and drug use, rather than more helpful coping strategies which include exercising, talking to a friend, or problem-solving the issues causing stress, says Dr. Noor. If stress is affecting your eating and sleeping habits, work, study and relationships, or if you are feeling overly anxious and worried, it's time to see your doctor and discuss the option of talking to a professional. Stress can get in the way of good judgment and decision-making. It can help talking to someone for some perspective and strategies to assist you to better be able to cope, advises Dr. Noor. Preventative measures. If you're feeling stressed, there are some simple ways you can alleviate or even prevent stress, many of which involve diet choices and exercise. It's important to identify the things that are causing your stress, then you can devise techniques to handle or avoid these stressors. This might involve preparing yourself for stressful situations, learning to delegate more tasks at work, or approaching a friend, colleague or family member and confiding in them that you need help. Exercising is also helpful as it combats cortisol, says Dr. Noor. A small pilot study in biological research for nursing found that after a 10-week exercise program, study participants had improved mood and reduced stress levels. Regular exercise is the key, as it produces a chemical response, endorphins, that triggers positive feelings. Not only does exercise help you work out frustrations and clear your mind, it encourages the body to produce serotonin, a hormone linked to mood and stress levels, which helps you get a good night's sleep, a key component in managing stress. APD Allison Martin says that a balanced diet also helps our body build resilience to everyday stressors. Amanda Clark, a Gold Coast dietitian specializing in mental health and author of Portion Perfection, couldn't agree more. Our bodies react really well to routine, and by consuming enough of all nutrients, you're providing the baseline for an appropriate response to stress. In addition to a balanced diet, certain nutrient-rich foods are particularly helpful when it comes to managing stress, while other foods can fuel it. Foods that fuel stress. The biggest stress-fueling foods are high-GI foods that are loaded with sugar and white flour. High-GI foods are quickly absorbed into the body, which makes insulin levels rise. This results in a spike in serotonin and tryptophan, which is a precursor to serotonin. The problem with this is that the insulin, tryptophan and serotonin levels will drop again, and this creates feelings of irritability and depression, says Amanda. This constant seesawing can be avoided by eating low-GI foods, like low-fat dairy, whole grains and legumes, that release energy slowly and keep your insulin and serotonin levels stable. The UK Food and Mood Project studied 200 people aged 26 to 55 and found that the common foods that increase feelings of stress are sugar, alcohol, caffeine, chocolate, foods with additives, and foods high in saturated fat. Ironically, the foods that stoke the stressful fire are also the ones we tend to turn to when we are stressed. This is a result of two things. Firstly, when stressed we feel we need an energy kick, and that is often found in high-KJ foods. Secondly, it seems that surviving a stressful situation creates a desire to participate in pleasurable activities, like eating high-energy food. A study on stress and food choices at University College London found that stressed, emotional eaters gravitated towards sugary, high-fat foods and a more energy-dense meal than the test group of unstressed and non-emotional eaters. See more at http://www.healthyfoodguide.com/articles/2011/December/eat-beat-stress #saint#87pr5.dpuf